So today, my name is Porleng and I'm the director of the Cambodia Pony Welfare Organization, CPWO. The organization was founded in 2007 by Dr. Steria Chune Kamrai and myself. Our vision is a world where human welfare is realized through good animal welfare in Southeast Asia. And our mission is to empower community in responsible animal ownership. With our international partner, World Health Welfare, we have been able to work with 84 communities representing 2,000 members. Our work is based on three main pillars. Number one, educational, with our workshop and training. Number two, preventional, with our rotation visit. And number three, punctual, with our mobile clinic. In 2020, with the outbreak of the coronavirus 19 in Cambodia, World Health Welfare and CPWO has conducted a survey to see how impactful the pandemic has on our communities and its working ponies.
I am Rinda, Project Manager and Senior Veterinary of Cambodia Pony Welfare Organization. We do a lot of activity with pony owner at community. There are pony treatment with mobile clinic, education people and the owner, pony dental care, farriery, saddlery, etc. Especially regular rotation, deworming and prevention to all the pony and owners. We have the difficulty to go into the community because of COVID pandemic in Cambodia. Some community we get authorization from the chief of village or commune to go into, but some community are not allowed because of COVID outbreak and it locked down. Our activity also doing COVID survey by starting interview our pony owner members by phone call. It is easy for us that we don't go out and travel to meet the people, but it is difficult to communicate because of local language. Some area is different. Local people not good at using modern technology. We need to take time to understand the question and not understand each other. In some area, the owner not use the phone. We have to go there, place to do the survey, but by interview them one by one.
I'm Natasha and I'm the Regional Coordinator for World Horse Welfare. I'm here to present our main findings from this survey. First thing is, we look at the type of work of the ponies. Now, the type of work is they transport mainly crop, freight and also people, and the type of work largely remains unchanged as compared to pre-pandemic levels. Now, what has changed is the workload itself. So 71% of the respondents have mentioned that there's a decrease in the workload, and when we asked for the reasons why, they mentioned that it's because of a change in the demand for their ponies rather than because of restrictions because of the pandemic. So naturally, when there is a decrease in workload, when we ask them about the income, they've also mentioned that there is a decrease in the income derived from their ponies. So that is majority of our respondents, is up to 79% of them. And compared to household incomes, 76% also mentioned that there is a decrease in the household incomes. So this shows that how the income from the ponies is interlinked with their overall household income. And the cost of upkeep, when we've asked them about cost of upkeep, the cost to maintain their ponies remains largely unchanged. Similarly as well, household expenses also remains largely unchanged for them as compared to pre-pandemic levels. So with decrease of income and with cost of upkeep remains unchanged, are there any support schemes that are available for them? When we asked them, most of them, 92%, actually said either they do not have any support schemes that are available for them, or that they don't know of any support schemes for them. Very few of them have some kind of support from financial institutions, governments, or different types of NGO relief. However, support for their animal health is there. So almost all of the respondents have mentioned that they have support from CPWO themselves to help maintain the health of their equine. And this is one of the positive aspects that we have seen, at least the short-term impact from this survey, is that the health of their ponies largely either remains the same, or actually the health has improved because of this pandemic. And similarly as well, when we look at the body condition of the equines, 65% of the respondents mentioned that there's increase in the body condition of their ponies. So we've seen a lot of short-term benefits that improves the welfare of the ponies, but we are also very concerned about the long-term outcome and whether the continuous decrease in the income would eventually have a negative aspect on their ponies.
The outcome of the survey has shown a clear link between the working ponies and the role they play in the community's livelihood by being the main source of income to the families. The villagers has been able to care for their ponies with the help of CPWO by preventing from sickness, where else the pony, if they are sick, it will be another burden to the villagers in their hardship during the pandemic. CPWO advocates for one welfare concept. By working at the grassroots level in the communities, we have knowledge of the human welfare needs, and we serve as a bridge to the human welfare organization.